When people hear WHO, they often think of pandemics, global emergencies, or headlines about bacon and cancer risk. But what and who exactly is the World Health Organization? How does WHO work with countries, and how does science become policy? If you're as curious as I am about what happens behind the scenes of public health, this episode is for you. Today we're joined by Dr Hans Kluge, WHO Regional Director for Europe, to talk about how the WHO actually works, how health decisions are made, why trust in health institutions matters, and what are some of the biggest health challenges facing Europe today. Hans, thank you so much for joining us.
My pleasure. Thank you.
So first of all, let's kind of understand what exactly is the WHO, because there's still a lot of, we all recognize WHO, but what exactly does the WHO do?
Yes. So there are many what we call United Nations agencies. WHO is what we call the specialized technical agency for health. So health is our mandate. What's our mission? Our mission is health for all. Health meaning not only the absence of disease that you have to cure someone, but also try to remain healthy, particularly as we get older. Now, could I in fact say WHO is maybe the biggest public health university in the world. It's not that we are necessarily knowing it all better, but we know what's happening in each of the 194 countries.
You kind of build the bridge between all countries,
Exactly.
so we all learn from each other.
Yes.
And that's interesting because we kind of have this idea that the WHO tells countries what to do, but that's not at all what
This
you
is,
do, right?
oh, Margarida, so important that you clarify this, that countries or people think, oh, I don't like the WHO because they tell I should be forced to be vaccinated. We should lock down the countries. No. We have what we call soft power. It means we are gathering the evidence, what's available of the science, and then give it to the countries to make sound policy. But our governors, we are what we call governed by member states.
But that's important because that's something I didn't realize. It's that you're actually, as an institution, you work with the country, so they also tell you these are our needs and this is what we need to focus on, right? It's you don't just decide, okay, this year we're going to talk just about alcohol or tobacco. The countries also tell you we have this special need.
Right. Actually, the WHO is the only UN agency which has 3 levels. The headquarters, most people know, is in Geneva. Right? Our Director General, Dr. Tedros, is sitting there, and they make a lot of guidelines which are relevant for all 194 countries.
Like breastfeeding guidelines, whatever it is.
Exactly, bravo. Or HIV, or tuberculosis. But this also means that it's quite generic. So what we do, like here in Copenhagen, there are 6 regional offices. The European office is one of them. We adapt this global guideline to the European region.
Okay.
And then we have a third level. In 153 countries, we have a country office. Like, for example, in, let's say, Ankara in Turkey, or in Chisinau in Moldova. And there are teams which are working according to the priorities of the country. We never impose ourselves. We ask to the country, to the Minister of Health usually, what is your national health plan? Where would you like to have some extra brain or extra hands?
But how does that happen? Do you meet with them? Is this something that is done multiple times a year? Is it like you have one big meeting with everyone at the same time?
Right,
I'm curious.
Right. Yeah, great points. So usually in October we have our governing board meeting. Then the 53 ministers of health come to Copenhagen, because my region is the one with the largest number of member states, from UK to Vladivostok, Turkey, Israel, Central Asia is a big one. We come together. But then in between, whenever there's a new minister, I invite him or her to Copenhagen to expose the minister to our whole work portfolio. And there is where the matching happens. The minister presents his or her priorities for the reform, and then we present our portfolio and we see where we match.
But then how do you, because every country is very different, either culturally, right? When, for example, thinking about alcohol policies, I'm sure it's very different from country to country. Do you, once you get all the evidence and you work on these guidelines, then do you meet with different countries and advise them in a different way? How does it work? Is it also, I want to ask you, is it challenging to work with the health ministers and advise them? How is that relationship?
Yes. So we work a lot sub-regional. For example, we work with the 5 Central Asian countries, with the Balkan countries, with the Nordics, and that works very well because they have similar language, similar history, and similar priorities. Now, on the relation with the minister, usually, often they are from the health field. We speak literally almost the same language, like you, Margarita. But the challenge is more with the other ministries. And what's very important to remember for the people is that actually the health sector accounts only about 20% for improving health. 80% depends on other ministers, like, let's say...
housing or...
Exactly, housing, which often has a bigger impact on health than a hospital.
But Hans, that's exactly, and even we had one episode with where Michael Marmot said...
Oh, yes, my friend.
He quoted a minister that said, every minister is a health minister.
Bravo, yes.
And it's exactly what you're saying, where really, I mean, if the person doesn't have a place to sleep at, or if their job doesn't give them the conditions to have a good life, it's very hard to give health advice.
Yes.
But then wouldn't it be important for example, the WHO to also meet with these other ministers? Do you think this is something that would help us look at the bigger picture?
Absolutely, spot on. Actually, we have a term for this. It's called health in all policies. So we are working on that one, never bypassing the Ministry of Health, but together. And that's what Ministry of Health appreciate from WHO. They say it's not necessarily that you say many more things, but it gives an importance with the WHO flag, exactly, to go together to the Prime Minister and say, without health, how can you have competitiveness? The challenge that we have, Margarita, and that's a big one, is we're not, as doctors, not always good in explaining to another minister the importance. We speak a little bit over jargon.
But it creates a gap between, that's true, the communication is a very important part.
It's essential. So now we are doing a lot of training into developing that narrative, and not only to ministers, also to the people. We have to explain to the person in the street what is WHO, what does it mean, to have healthy lifestyle, to speak people language.
But for example, we had a recent heat wave that was very big, and for me that was the perfect example of everyone, they're interviewing health experts on, okay, what things do we need to be careful about with the heat wave? But really this is a problem of climate change, of housing, like houses are not ready for the heat wave. And I feel like that's the challenge. How do you get the other ministers to realize that we really all need to work together? And it can't just be the health policies. It needs to be like the global policies.
Yes, everything starts with data. WHO is I always say, the guardian of good, sound data. And the data speak for itself. Last year, 50,000 people in our region. This speaks to every minister. But for the heat, actually, a lot of action is to happen at the local level. If I went to Berlin, I mean, it's amazing. The Health Commission in Berlin implemented 72 actions of our action plan guidelines. For example, to put blue water fountains. It's very simple, but people see it, oh yeah, I'm reminded I should drink before I get thirsty, right? Or they put shaded bus stops or play yards. So there are very simple things to do that does not necessarily cost money, including in places where you don't have air conditioning. Right?
It's interesting to see that even this concept of One Health, or building a healthy city. Sometimes it's not just about giving advice; it's also about creating an environment where it's easier for you to be healthy. And the WHO also does that, right? You get all of this information, and from working now in the podcast, what I thought was fascinating is the transparency, the fact that everything is very evidence-based, and you're very careful making sure that everything has no conflicts of interest and all of that.
Very important. Yes, because sometimes people say, oh, are they influenced by the industry or by the pharma or this? Listen, the WHO really has to stick to its scientific independence. Not everyone likes it, what comes out of the evidence. For example, we know now that every level of drinking alcohol harms. We are not telling to the people that they cannot have a beer anymore or something. We're just giving the evidence that it harms, it increases 7 types of cancer, and then it's up to the country, it's up to the people to do. We don't have this mandate, and we shouldn't do this, but we should tell what is evidence.
Yeah, it's really interesting because it's exactly that, where that when you give a recommendation, you just want people to have the knowledge on their side so they can make an informed decision.
Informed decision, yes.
Never telling people
Yes.
what to do.
Yes.
And that leads me, so I want to get to know you a little better as well, because I know you were also a family doctor, and I'm a family doctor.
Yes.
And then how did you go into public health and into the WHO? How did your interests go into that? I'm curious.
So I was educated by my dad, a surgeon, and my mum, a nurse,
Okay.
according to a simple but very important principle that each person is to be treated independent of religion, background, sexual orientation, gender. So I started as a family doctor, and then I started with Médecins Sans Frontières, with Doctors Without Borders, in some very difficult circumstances during the civil war in Somalia. And there I got to know, if you really want to have a big impact, you want to have an impact on thousands, 10,000s of people, this is public health. This is good policy. Good policy save lives.
That's, I think, once you dive into all these themes, that's exactly what you realize. And as a family doctor, that's it. Sometimes I realize that we need health policies that protect people.
Yes.
And it's not enough to just say this is healthy, this is unhealthy.
True.
You need to...
Yeah.
What did you learn from that experience and working in Doctors Without Borders? Is there anything that you took from that and that still has impact in your work today?
Absolutely. First thing, people are the same everywhere. I worked in North Korea, in Myanmar. You know, people want one thing, a better future for their children. That's it, right? So health is very important because mortality under 5 years is too high still. Maternal mortality, I mean, can you imagine, every 2 minutes still a pregnant woman is dying because there is no safe delivery. I mean, it's unacceptable. So there again, training of skilled birth attendants, doesn't have to be necessarily a doctor, is very, very important. So this gave me the motivation always to keep in mind, if you make policy, will it change the life of the most poor, the most vulnerable? And I have a special initiative. It's to address violence against women and girls. We're not doing, I just saw the figures. When there is a, now with the football, if one, I will not name it, one country was lost, with 30% domestic violence was increasing. I mean, it's crazy. And no one talks about that one. And that was given to me in Somalia when I saw girls who you know, were suffering a lot. And also how you have to try to address this in the local culture. You cannot come and then you had to talk with the tribes, with respect the culture. So it's
you can't just go and,
exactly,
and
yes.
put rules, right? You need to understand why things are happening and also understand the culture.
Right, right. And this is the same in Europe as well. So this basic respect for everyone. No, everyone has right to health and to dignity.
Every human life is a human life and should be respected.
Yes.
But that's super important, and I think what should drive every health professional to be a health professional.
Yes.
But health inequalities are very hard to fight, and sometimes we kind of fall into this myth where, well, why should I, if I'm privileged, why should I be worried about it? But fighting health inequalities is important for everyone as a society, right?
Yes, especially, you know, what we see happening in the world is pretty scary. No, we create what we call two-tier systems. It means I'm, like you were mentioning, I'm rich, I can pay for healthcare. I'm poor, I have to wait for months and maybe I will die before, right? So this is a red line. We have to stand strong in the region and globally on equity, also from a even egoistic point of view, I would say. What did we see with hantavirus, with Ebola? That no one is safe until everyone is safe. You know, I can be very rich and have all the wealth, but a virus doesn't stop at my home, right?
Of course.
I have to breathe.
Yeah.
So in that sense, it's both a value issue that we have to help each other, but also health security. That there's so many health issues, climate change, we mentioned already, no one escapes from it.
And wouldn't you say that's also why it's so important to have health institutions that are independent and that are giving this advice and coming up with all this information so that we make sure evidence and policies are accessible to all and take everyone into account?
Absolutely. Two things. One, WHO really need to focus on evidence, independent. And number two, which some countries have difficulty with, we shall never politicize health. There are many wars in the world, health for all. You know, people, the normal people, No one wants war, right?
Of course.
If a child with cancer in some war-torn country, we shouldn't look to what's happening with the government, we should help the child.
Health is a human right, and it shouldn't
Exactly,
be.
yes.
But that's sometimes a challenge with countries. That decisions on political
Yes.
On health policies are very political instead of evidence-based and
True.
separate.
Absolutely. This is red line. I mean, health for everyone.
Yes, for sure. I also wanted to ask, because we associate a lot of WHO with, COVID and emergency and pandemics. But how is the day of a person who works at the WHO? Because there's a lot of other stuff you guys,
True.
it's not just about that.
We work a lot on what we call preparedness. The best way to manage a crisis, be it a heat wave or a chemical disaster or a flooding or earthquake, is to work on preparedness. And for this, we published the guidelines on heat health action to prepare cities and countries before it hits, and that we do a lot of training. We do a lot of capacity building, exchange between the countries. So this is one element. Number two is to keep the world safe. People don't see this, but in this building we have an emergency room where every single day we analyze about, I think, 20,000 what we call signals picked up from media, from newspapers, from surveillance. It's something that could become a threat. Okay. For example, we had children dying still from cough syrup, which was toxic, or from baby food, which was not safe.
Oh, wow, okay.
Or a virus, a variant of a certain flu virus that we don't know yet, is it going to become an outbreak or not? So we are analyzing this. It's like, actually, I have to remember, I think it was Sherlock Holmes he said, if it's quiet, it means we're doing a good job.
Yes.
But usually we're in the news when it explodes. But if it's quiet, it means my guys here are doing a good job.
That's like prevention, right? When
It's
it works,
prevention.
people don't realize
Absolutely. Prevention is so important.
I remember they told me this in the first year of medical school. They're like, if you're doing your job right, no one will really tell you're there.
Yes.
But if you do something wrong, everyone will know. And with the WHO, this kind of happened with COVID. And one argument that a lot of people have is, oh, why should I trust the WHO after what happened with COVID? How would you react to that? What would you tell them?
I think first and foremost, not to be defensive. We could have communicated better. We spoke about communication. That to explain to the people that good science takes time. Now, what was the big headache? That there was no time. Because people were dying from, let's not forget, a completely new virus that we didn't know. For example, usually you would infect someone with a virus if you have symptoms. You're coughing. But for the COVID, even we found out later on that without symptoms,
you could still
transmit. We didn't know this. So when all of a sudden WHO told masks are very important, people were telling me these guys are flip-flopping. No, it is because the science developed. But what we also learned is that we had to give advice to countries before we knew with certainty that something was proven. We couldn't wait. And that's why it's very important to tell the people what you don't know. Very transparent, that we don't know. The moment we know, we're going to tell. And it's not because we flip-flop policy, it's because we have new evidence. This is very important.
But that's and science usually isn't very like that because we don't want to admit we don't know something. But for the population, don't you agree that, yes, it's better when we admit, okay, this we still don't know, so let's be careful.
Absolutely.
But you definitely, and I feel like, do you think if a new emergency came, you would be a lot more prepared and learning? And that's the thing, it doesn't take credibility away from an institution when you admit that, okay, there's things that we are looking into.
Absolutely. Transparency, integrity. People will much more trust an institution that is open to learn the lessons, which we did. We did a lot of lesson learning on that one, than an institute which, thinks that it knows everything, basically. That absolutely is very key.
Do you also think that there's a lot of formality in these institutions, right? Yes. And from an outsider's perspective, I do understand you have to build credibility, but don't you think the language is also sometimes a barrier to get to the population?
Oh, absolutely. Actually, I was surprised when we got to know each other. You asked me if I could say Hans.
Yeah, can I call you Hans?
Yes. Everyone is a person. We should really communicate with. Actually, we should communicate different to different audiences, because to the scientists, I mean, we have to be very, very scientific. But you're absolutely right. To the people, I always tell to my communications people, make sure that my granny from 80 years understand the press statement.
Yes, for example, the report on cancer, it's like 300 pages and it's super interesting. As a doctor, I was reading it and I was fascinated. But it's also important that that information gets to people in a more informal
Absolutely. Actually, that's why one of the first things I did 7 years ago when I became regional director was to establish the Youth for Health movement. Actually, my eldest daughter is also a part of it. I am asking them advice how to communicate to the youth.
Yes,
you know, I'm still using myself Facebook. I mean, who looks to Facebook? The same generation, but they are on the TikTok, on the Instagram. So ask the youth their help. There are many enthusiastic youth who wants to help us.
That's super true, and it makes me think about another problem, which is misinformation and disinformation,
a big one. Yeah.
which is a big thing. And I think sometimes it's also the fact that because people don't have information in an easy way and without jargon and everything, they look for information where it is.
Yes.
Do you think it's also a health threat, and how can we overcome it and maybe also be there and be present?
It's a big threat. I know with AI, almost you don't know if something is real or not. So of course, all this information, first I start, you know, I'm an optimist, so I start with the positivity. Actually, it helped a lot also during the lockdown, for example, that still there was social contact. So it has this advantage, but people to take information from trusted sources. Actually, who's doing this very well is your home country, is Portugal. I asked once to a previous minister why the vaccination rate are always so high, and she was saying, listen, Hans, we have this from primary school, from the schools. I'm a great supporter of collaboration between the health sector and the education sector. If children are, exactly, Finland also, if you, the earlier you educate the children, the better. That vaccination is part of good practice, right? Of being healthy. A healthy society is actually a big one, really. Yes.
Yes, tackling schools and the fact, because a lot of myths that we have come from the very, you know, what you learn in school and what you get told.
And also what I call the trusted people in society. I always remember that my daughters, who in the beginning also didn't want to wear a mask, were wearing a mask not necessarily because their father, regional director, was telling, but because their sport idol was wearing a mask in the tennis or the basket. Actually, here it's a good example with the Mpox. What I did in the beginning of the Mpox, I immediately invited the people in charge for the prides, you know, and we sit together and we gave very clear messages also to the LGBTQI plus community. Actually, Portugal did this very well with the Mpox before vaccination by empowering trusted people in the society. They know how to communicate. Another one was during COVID-19. I went with the Minister of Health in Greece to meet the priests and archbishop, because there it was the elderly people who didn't want to be vaccinated at some rural islands. Who did they trust? It was their clergy, their priests. So let's think who the people trust, right? And work with them and empower them with scientifically sound messages.
And also, and that's something you here at the WHO you do a lot, which is listen to the population, so understand what the questions are. Because sometimes when we're in the scientific field, we think the questions are one thing, but then people actually want to know another. And so listening and understanding that is also helpful.
Yes, good. It's basic, no? Listening. But we forget to listen nowadays.
True, exactly. And it's the first step of communication. When you look across Europe and Central Asia today, what health challenges worry you the most?
You mentioned already, right, the inequalities. This is in every country. It's not anymore between you're a poor country or a rich country, within one and the same country, particularly big cities. You have a lot of poverty over there and then a lot of sickness. Of course, we have a pretty complicated region. We have triple burden, I call it, triple agenda. Number one, what I call the unfinished agenda, maternal and child mortality. You know, it's a big issue. Second is what we call the chronic diseases, non-communicable. Most of us,
diabetes.
Yes, diabetes, heart disease. Most of us are going to pass away from a heart attack or a stroke. And then third one is still the communicable, the infectious disease, tuberculosis, HIV/AIDS. And across those three, I am very, maybe that's my biggest concern, is mental health. The mental health in the youth in our service, but also in the healthcare workers. 1 out of 3 healthcare workers is really struggling, particularly after COVID-19. So mental health, the biggest thing we have to do is to talk about it. It's not, still there's a lot of stigma and discrimination within the health workforce as well. I always say, it's okay not to be okay. Everyone can have a dip. It's fine. Talk to each other.
But it's also, I feel like it's a manifestation of a much bigger problem. The fact that, why are we so anxious? And there's so much of, because really there's a lot of stuff going on.
Yes.
And when we talk about health inequalities, it's very important to talk about it. But sometimes I wonder, what can we do to tackle this? Because it's becoming very hard. And you talked about infections. I always think about tuberculosis, for example. There's a lot of infections where, or even cancer. If we look at cancer, the probability of you being able to fight that cancer and having access to treatment has a lot more to do with your postal code than your genetics. And this is frightening, right? Because it shouldn't be, it should be accessible to all. How do we fight this?
Actually, I will go back to your core business and my core business, primary healthcare, family medicine. I am such a strong believer of primary healthcare. Bring the care closer, first and foremost for prevention. Right? You can keep the people healthy. When I was a family doctor in Belgium, I was basically the trusted figure of the whole family. So when I went somewhere, you knew the whole situation, and each time, each encounter was an opportunity for some counseling, for some health education, maybe to smoke a little bit less or to drink a little bit less, because they trusted me. And if a disease like cancer is being detected, to try to do it early on, because we can treat and manage a whole number of cancers. We need to be early. In the hospital, it's too late.
I think general practice and public health have this in common. Their job is a lot about people not needing us too much. And so it's very invisible, and that's challenging. At least where I come from, I see this a lot, where people don't really value primary care. We celebrate a lot this innovative treatment that treats cancer, but then we have tools that help us prevent so many diseases, and there's no awareness or investment in them. So that's also a little challenging, right?
I must say, Marie, that at least when I speak to ministers, from 10 years ago, the narrative is changing. They see with the aging of the population that the hospitals are collapsing. So they have to move it out too. And how do you manage aging? Again, not by managing the elderly people, start early.
Of course.
Because the life expectancy increased with 10 years over the last decades. But we live older, sicker.
And we want to live with quality of life, right? Not just longer.
Yes.
So if governments could do just one thing that would improve health for millions of people, what do you think it would be?
Oh, this one is straightforward, and I'm going to be very blunt here. It's to stop the war. I have both Russia and Ukraine in my region. Every day, how many hundreds, thousands of people are suffering. Then Israel, Gaza. The best medicine is peace. Losing so many people, this is something very, very painful.
Yes.
I know we have another one in the Middle East, which is bordering our region. This is what governments should really sit around the table, right? We don't politicize health. And then what concerns me most of all, and keeps me up at night, are these attacks on healthcare, on hospitals, ambulances. When I was working during civil war in Somalia and Liberia, I saw some cruel things, but I was protected by my white coat. Now it's crazy, and it happens so much that I see it becomes a new normal. This cannot be. This cannot become the new normal. We have to be activist and revolutionary on that one. Is a no-go.
Hans, that's so interesting, because it goes back to what you said in the beginning, that every person has the right to be healthy. And also it makes me think, when we learn CPR, the first thing you're taught to do is to check if you're safe to save that person.
Bravo. Exactly. Yes.
And when you replied, when I asked the question, maybe I was thinking you would say stuff like, a health policy. But it's like, peace, you need security to implement health, to implement healthy lives. So now let's look into the future. What gives you hope, and what would your top priorities be for the next 10 years of the WHO?
Hope is very important. I always say hope dies the last. So there was something gave me tremendously hope a couple of months ago. there was the 75th anniversary of the International Federation of Medical Students, and it was in Denmark, because Denmark was a founding member. And I was speaking Friday evening, 10:30 at the closing, still everyone enthusiastic. I was looking around and I was saying, when I spoke, there was such enthusiasm and applause. I say there is a new generation of doctors, nurses ready to take on the challenges. So I'm a great believer of youth, great believer. Yes.
And let me just ask you, not sure if you don't want me to ask this question, but there is...
You can ask any question.
Okay, no. But I also think it's important for people to understand, what do we risk if we stop having institutions like the WHO, which are independent? Is it something that we should be worried about? And I mean, because it is so important in the way that it worries about health inequalities and making sure health is accessible to all. Is it something we should really value before it's too late?
Absolutely. We don't need a weaker, we need a stronger WHO. I want to give an example here. It's which country was responsible to tackle hantavirus? You know which country? No country. So many nationalities. You know, the boat was there, no one. And you saw no one wanted to deal. WHO was there. We spoke to countries to let the ship disembark, right? To help the people. There has to be at least one global health conscience that no one is being left behind.
Hans, thank you so much. This was super interesting. It's
Thank
interesting
you.
to look
For
at
me
the
too.
behind the scenes.
I learned a lot.
And thank you so much for letting me call you Hans and do
No
all the
worries, sure,
questions.
sure.
Yes, thank you so much.
Thank you. Thank you, my pleasure.